Hello, everyone, and thank you for being here today. I'm excited to introduce our presentation titled The Unraveling of a National Catastrophe, a Case Study in Healthcare Fraud. On this first slide, you can see the striking title that sets the stage for what's to come. Today, we'll explore how a massive and complex healthcare fraud scheme was uncovered, involving billions of dollars in false Medicare claims, international money laundering, and identity theft. We'll also look into the details of Operation Gold Rush, the largest coordinated enforcement action in U.S. history, carried out by the Department of Justice and multiple federal agencies in June 2025. So, let's dive into this critical case and understand the scope and impact of this national health care crisis. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, before we jump into what could have been done differently, it's important to really understand what GRC stands for and why it's so vital in healthcare cybersecurity and operations. GRC is an acronym that covers three key areas: governance, risk management, and compliance. Let's start with governance. Think of it as the set of systems and processes that ensure accountability and transparency within an organization. It's about having clear strategic direction, establishing ethical leadership, and setting up formal policies. It also involves maintaining audit trails and ensuring that the board oversees how health data and services are managed. Essentially, governance creates the structure that guides and controls everything. Next, risk management. This is a continuous process. It's not a one-and-done. It involves constantly identifying potential risks, assessing how serious they are, prioritizing which ones need immediate attention, and then implementing measures to mitigate those risks. In healthcare, this could mean protecting against data breaches, insider fraud, or identity theft, risks that can seriously compromise security, data integrity, or overall system performance. Finally, compliance. This is about following the law and adhering to regulations, guidelines, and standards relevant to healthcare. Examples include HIPAA, the False Claims Act, Medicare billing rules, and anti-money laundering laws. Staying compliant isn't just about avoiding fines. It's about maintaining trust and integrity in how healthcare organizations operate. When all three areas, governance, risk management, and compliance, are fully integrated into a cohesive framework, they form a robust defense system. It's like having people, processes, and technology all working together seamlessly to protect against fraud, mismanagement, and legal liabilities. And that's the core of understanding GRC. It's about creating a comprehensive, proactive approach that supports the security and integrity of healthcare operations at every level. Now, let's take a closer look at where the governance failures actually occurred. First, one of the biggest issues was the lack of ownership vetting. There simply weren't enough protocols in place to verify who was really behind these companies. This meant that foreign actors and straw owners could register and operate DME companies without proper background checks or cross-border identity validation. Essentially, the system was too easy to manipulate. Next, we saw an absence of board oversight. Many of these medical supply companies operated without any real executive oversight or compliance committees. Without a board-level responsibility, there was no one ensuring that actions taken were lawful or ethical. This lack of oversight created gaps that bad actors could exploit. And then, there was the problem of record-keeping. These companies often didn't keep centralized digital records of their purchases, deliveries, or patient verification processes. Without mandated data logs, there was no clear trail to audit claims or identify inconsistencies. This made it much easier for fraudulent activities to go unnoticed. So, what should have been done? Governance should have implemented mandatory ownership screening protocols, requiring thorough background checks to verify identities. They also should have required registered governance, risk, and compliance officers, GRC officers, to oversee these processes. And finally, regular quarterly governance audits would have helped catch issues early and maintain accountability. All of these measures are vital to strengthening oversight and preventing the kinds of failures we're discussing. They connect directly to our overall theme, highlighting how breakdowns in leadership and oversight can have serious consequences if not properly managed. Now, let's look at some of the critical gaps in risk management that allowed these issues to persist. First, there was no continuous risk monitoring in place. Medicare and private insurers didn't have automated, real-time systems to keep an eye on billing patterns across durable medical equipment providers. As a result, thousands of claims, many of which looked statistically abnormal, went under the radar without any scrutiny. Next, there was a failure to detect stolen identities. Patient records and doctor identities were often stolen or forged to support fraudulent claims. Unfortunately, no cross-validation systems existed to compare billing data with actual physician-patient records or to flag inconsistencies in prescribing behavior. This made it easier for fraudsters to carry out their schemes unnoticed. Another big issue was the lack of data sharing across different institutions. Public payers like Medicare and private supplemental insurers operated in silos, which meant they weren't sharing critical information. This allowed fraudsters to bill both entities separately, collecting payments from both until red flags finally emerged independently at each organization. So, what should risk management have done differently? Implementing AA-powered billing analytics platforms would have been a game changer. These systems can detect unusual patterns in real time. Having a centralized risk intelligence dashboard would also provide a comprehensive view across all data sources. And finally, instituting risk-based audits, especially for high-volume providers, could have caught suspicious activity early and prevented so much fraud from taking hold. Connecting all of this to our overall theme, it's clear that proactive, integrated, and technology-driven risk management strategies are essential to closing these gaps and protecting the integrity of our healthcare systems. Now, let's take a closer look at some of the key compliance breakdowns and where things went wrong. One major issue was the lack of prepayment verification for claims. Medicare's legacy system would pay out claims before verifying if they were legitimate, which criminals quickly exploited by submitting large volumes of fake claims with no real medical basis. Another critical failure was in enforcing anti-money laundering laws. Banks and payment processors didn't apply the necessary AML checks to high-risk accounts, allowing hundreds of millions of dollars to flow overseas unchecked. This loophole created a huge vulnerability that bad actors could easily exploit. We also saw serious issues with HIPAA compliance. Patient data was accessed, sold, or even forged, violating privacy protections. The problem was compounded by the fact that there was no cross-checking of consent logs, so these violations often went unnoticed. So, what should have been done differently? For starters, requiring digitally signed patient consent forms would have created a clear, verifiable record of patient approval. Enforcing Know Your Customer standards at banks would have helped prevent illicit transactions. And auditing third-party software for HIPAA compliance could have caught potential violations before they happened. Connecting these points to our overall theme, it's clear that these breakdowns stem from gaps in oversight and enforcement. By tightening controls and standardizing procedures, we can build a more resilient system that better protects patient data, ensures legitimate claims, and prevents financial crimes. Now, let's explore how GRC, or governance, risk management, and compliance could have acted as a unified defense system to prevent issues like Operation Gold Rush. Starting with governance, this is about having strong oversight and accountability. If we had proper verification processes and conducted regular audits, we could have prevented fake ownership claims and ensured that every company involved was operating ethically and transparently. Moving on to risk management, this involves leveraging technology to detect anomalies before they escalate. AA-powered analytics and real-time monitoring could have flagged unusual billing patterns or outliers, catching false claims early and stopping payouts that shouldn't have happened. Then there's compliance, ensuring that all transactions and service verifications are complete before money changes hands. Digital verification methods and strict adherence to regulations would have made sure that services, patients, and providers were properly verified, reducing the risk of fraud. Altogether, these GRC principles create an airtight shield, one that could have stopped Operation Gold Rush before even a single dollar left the system. It's a reminder of how a cohesive, proactive approach can make all the difference in safeguarding integrity and trust. Now that we've discussed what should have been in place to prevent a crisis like this, let's turn our attention to what healthcare organizations can start doing today. The goal is to leverage modern technology, implement policy reforms, and enhance education to make sure something like this never happens again. First, let's talk about governance enhancements. It's crucial to have thorough verification of business owners, ensuring we know exactly who is behind the organizations. Establishing high-level compliance committees helps oversee adherence to regulations, and robust whistleblower programs encourage staff to speak up about concerns without fear. These steps create accountability at every level, which is vital for a resilient system. Next, risk management improvements are key. Using AI-driven analytics allows us to identify potential issues before they escalate. Prepayment verification adds an extra layer of scrutiny before claims are processed, reducing fraud and errors. Federated intelligence dashboards bring together data from multiple sources, enabling us to detect patterns quickly and respond swiftly. The goal here is smart detection paired with rapid response. Finally, compliance controls are essential to stay aligned with regulations. Automated anti-money laundering monitoring helps flag suspicious transactions in real time. Electronic visit verification ensures that services are delivered as billed, and implementing prior authorization with clinical validation helps confirm that treatments are appropriate and necessary. All these measures connect back to our overarching theme, building a more secure, transparent, and accountable healthcare system that can withstand future challenges. By adopting these strategies today, we take meaningful steps towards safeguarding the integrity of our healthcare services. Now, let's look at how we can leverage smart detection and rapid response to manage risks more effectively. One key area is AI-driven predictive claims analysis. By deploying machine learning systems that analyze billing patterns in real time, we can identify potential red flags, such as sudden spikes in claim volume, duplicate patient usage, or unusual combinations of diagnoses and procedures. These insights allow us to automatically suspend or flag claims that exceed a certain risk threshold, so they can be investigated further before processing. Another important tool is prepayment verification edits. These involve integrating analytics that scrutinize claims before any payment is made, catching suspicious activity early. Using data-backed edit rules, especially for new providers, helps us spot elevated risks proactively rather than reactively. Finally, federated risk intelligence dashboards take this a step further by creating a unified platform that multiple stakeholders, hospitals, payers, pharmacies, and government agencies, can access. This platform shares critical insights like billing volume outliers, inconsistencies in doctor or provider data, and duplicate patient identities. By sharing this information broadly, we improve our collective ability to detect and prevent fraud, waste, and abuse across the entire healthcare ecosystem. Altogether, these tools form a comprehensive risk management approach, making our processes smarter, faster, and more collaborative. This aligns perfectly with our overall goal of enhancing transparency and integrity in healthcare payments. Now, let's look at some of the key compliance controls that help us cover both financial and regulatory bases effectively. First up is automated anti-money laundering monitoring. Here, we leverage RegTech providers to screen provider-level payments against watchlists and monitor wire transfers. This process uses Know Your Customer protocols and suspicious activity reports to catch and prevent any fraudulent money movements before they happen. Next, we have electronic visit verification. This is especially important for home health and durable medical equipment deliveries. By requiring GPS and timestamp check-ins and checkouts, we can automatically deny claims if the field staff can't verify that the actual service visits took place. It's about ensuring accuracy and authenticity in service delivery. Finally, there's prior authorization with clinical validation. This process involves automatically reviewing the clinical justification for high-cost services. We also require digital signatures and attestations from physicians to confirm the legitimacy of the requests. This helps us prevent unnecessary or fraudulent billing, while also ensuring that care is appropriate and justified. All of these controls are interconnected and serve the overall goal of maintaining compliance, reducing fraud, and ensuring patient safety. They're essential tools in our broader effort to uphold integrity across the entire healthcare system. Now, let's take a closer look at some of the recommended automated systems and tools that can really enhance our fraud detection and compliance efforts. First up is Olivia 360TM, which is an advanced AI platform that combines early fraud detection with payment integrity analysis. What that means is it helps us catch potential fraud risks early on and ensures the payments we process are legitimate, reducing financial losses. Next, we have the Healthcare Fraud Shield, or HCFS platform registered. This is an end-to-end fraud prevention tool that leverages AI to identify suspicious patterns and support investigative workflows. Essentially, it acts as a comprehensive safeguard, helping us spot fraud activities quickly and streamline investigations to respond faster. Moving on, Symbo AI Prepayment Edits offers real-time, rule-based filters that block suspicious claims before they even go out for payment. This proactive approach minimizes the risk of paying fraudulent or erroneous claims, saving time and resources. Then there are reg tech platforms like ComplyAdvantage, Quantifind, and ThetaRay. These tools are vital for financial compliance. They help with anti-money laundering efforts, customer verification like KYC, sanctions screening, and tracking financial crimes. They're crucial in maintaining regulatory compliance and mitigating financial risks. Finally, EviCore IntelliPath is an AI-powered platform that analyzes clinical documentation before services are authorized. By doing so, it ensures that clinical claims are accurate and appropriate, reducing unnecessary costs and improving the quality of care. Connecting all these tools back to our overall theme, they represent the cutting edge of automation and AI in healthcare, helping us become more proactive, efficient, and compliant while safeguarding against fraud and financial crimes. It's about leveraging technology to create a smarter, more secure healthcare environment. Now, let's talk about how we can sustain long-term protection through culture and operational integrity. First, comprehensive staff training is crucial. We should hold annual workshops focused on fraud awareness, where we cover key topics like recognizing red flag indicators, understanding HIPAA confidentiality standards, and knowing the proper procedures for reporting suspicious behavior. Including simulations and real-world case studies makes these sessions more impactful and helps staff apply what they learn in real situations. Next, leadership plays a vital role in governance, or what we call GRC, governance, risk management, and compliance. It's important to appoint dedicated leaders, such as a chief compliance officer to oversee regulatory adherence, and a chief data ethics officer to ensure our AI platforms operate fairly and transparently. These roles help embed a culture of integrity at the highest levels. Building strong, collaborative relationships is also key. Formalizing quarterly meetings with government agencies, CMS, state Medicaid offices, and insurers allows us to share fraud trends, discuss emerging risks, and coordinate responses more effectively. This proactive communication helps us stay ahead of potential issues. Finally, ongoing audits and continuous improvement are essential. Running quarterly, stress tests on billing patterns helps us detect anomalies early, while reviewing audit results annually provides insights into where we can improve. Bringing together remediation working groups ensures we address any issues comprehensively and adapt our strategies as needed. All these efforts, training, leadership, collaboration, and continuous audits, are interconnected. They create a resilient culture that not only detects fraud but also deters it, aligning perfectly with our overall goal of safeguarding long-term integrity and trust. Building a resilient future for healthcare means learning from the past and taking proactive steps to prevent fraud before it happens. The 2025 Operation Gold Rush really exposed some critical vulnerabilities across the healthcare ecosystem. It's a stark reminder that we need to be smarter and more vigilant. To do that, healthcare organizations must focus on key areas. First, identity verification is essential. We need modern tools that can verify identities and screen ownership right from the start, effectively blocking fake companies before they even get off the ground. This helps us catch problems early, rather than dealing with them after the fact. Next, AI analytics play a crucial role. By leveraging AI-powered real-time analytics and prepayment edits, we can flag suspicious bills before they're paid out. This proactive approach minimizes the risk of fraudulent claims slipping through the cracks and saves a lot of money and resources. Financial monitoring, especially using RegTech tools, is another vital piece. These advanced tools can detect laundering attempts or unusual financial activity early, giving us a chance to intervene before much damage is done. But technology alone isn't enough. Building a sustainable culture of integrity requires integrated workforce training, strong leadership accountability, and collaboration across agencies. When everyone understands their role and works together, we create a culture that resists fraud and sustains trust. When healthcare organizations adopt these principles and tools, they build a smart, proactive shield. It stops fraudulent activity before money even leaves the system, ensuring long-term integrity and trust in healthcare. That's the future we're all working toward, a safer, more trustworthy healthcare environment for everyone.